The sun no longer sets on Nigerians. This is because Nigerians can now be found in virtually all nations and regions of the world. In Tall Drums, we bring you stories of Nigerians making remarkable contributions to the improvement of the human condition. Here is your host, Dr. Ugoji Ugoji.
Hello and thanks for joining us on this episode of Tall Drums, a Nigerian American journal. In the state of South Carolina, the presence of one Nigerian-born cardiologist has become stuff of folklore in the community. In February of 2001, Dr. John Kalu Igemi came to Georgetown, South Carolina for what he thought would be a one-week rotational stint at the local hospital called Georgetown Memorial Hospital. In a few days, there was a community-wide campaign mounted to keep him from leaving town. His stay at Georgetown has brought a financial windfall for the local hospital and for the cardiology group that brought him to town. Tall Drums traveled to South Carolina for this interview with Dr. Igemi.
Tall Drums is presented by Sungai Corporation, publishers and consultants.
Well, Dr. Igemi, welcome to Tall Drums.
Thank you, Dr. Olaji.
Thank you for joining us. Let's start with a discussion of your childhood. Where were you born in Nigeria and where did you grow up at?
I was born in Aba, Abia State. Essentially, I grew up there as well, but made frequent visits to my hometown, which is in Eda, in Ebonyi State. But I was schooled in Aba. Aba is my town, that's where I grew up.
You did your elementary education?
My elementary school was in Aba as well.
Which school was that?
Called Niger Delta Diocese. It was in Overell, Izugu Aba. That's where I attended my high school. Prior to completing my high school, the Civil War broke out and disrupted, and I had to move back to the village, which was in Eda. And finally, after the Civil War ended, I completed my primary education at St. Patrick's, to Eda Primary School. I proceeded to high school, then came back to Aba and attended Eziama High School, where I attended and graduated in 1976.
1976?
Yeah.
You spent all 5 years
at
Eziama?
Correct.
Okay. What were your favorite activities at Eziama?
Soccer.
Okay.
I used to play soccer. My senior year, I was the skipper, the captain of this school team, soccer team. We won the state championship the year that I was there. Became runners-up the second year.
I see. Okay. And then after high school, you worked a little bit before you came to the
worked a little bit. I was signed up with the Nigerian Prisons Service. I worked as a corrections officer in Owerri. While in Owerri, I took some advanced courses at Holy Ghost College at Owerri. Right after that, I started going to. What happened was just after I finished working for the prison service, one of my brother-in-laws, Mr. Chukwuoje, was interested in starting a business at Makurdi, Benue State. We had interacted previously during the Civil War, and then at that point when he was about to start a business. He thought I was the right personality to get that business going. I helped him establish Benimo Enterprises. Essentially, what I did was a sales representative for System Metals, aluminum manufacturing company, now based in Calabar. My duty was to travel the whole of Benue State, marketing aluminum roofing sheets, providing quantity surveyor, and then costing, and then delivering those equipments as ordered.
And at some point you decided you would go back to school.
Correct.
And you also decided you would do it overseas.
That's correct.
Eventually ended up in America. Why America as opposed to anywhere else?
Well, I had read a lot about the United States while in Nigeria. As a young man, you had all kinds of stories about how great America is and what it holds for anybody who was able to make it there. In Nigeria, I had passed the Nigerian Defense Academy, Kaduna, to go to NDA. Following the interview, I was not drafted, so I was a little bit distraught. There and then I decided, well, I'm going to seek my opportunity elsewhere, and America became a logical place as opposed to any other country. Having read about it quite a bit and understood what the system holds in store for anybody who's willing to work hard and play by the rules.
Now, you arrived in the United States when?
August 29, 1980. I arrived at JFK. My concept of the United States is I could get a bus and go to Nebraska, where I had been accepted to attend the Midland Lutheran College. Much to my surprise, it was quite a distance, so I had to buy a ticket, fly to Chicago. From Chicago, I flew to Omaha. Then I rode a bus to Fremont, which was a small town, 23,000 people northeast of Omaha, Nebraska.
And that was where you did your
my first degree.
In what?
In biology, chemistry, and natural sciences.
Okay. And then after that?
After that, I had the intention of going to medical school. However, because number one, I was not well established in the United States, I was placed on hold and what they call alternate list to come to medical school at the University of Nebraska Medical Center. While I was on that hold list, Creighton University invited me to attend a pharmacy school. I did not apply there originally, but I took up the offer and did what they call accelerated program in pharmacy. So in 2 years, I earned a BS in pharmacy. And then 2 weeks after graduation, I was accepted to attend 4 medical schools. But because I was better acquainted with the logistics in Nebraska, I decided to go to University of Nebraska Medical School.
So obviously you had made up your mind at some point that you would be a doctor.
Correct.
The question is why? What led you to that decision? Why medicine as a choice of career?
It was in December of 1970. My mother was having her last baby, and at that point she had some complications, but the physicians who were on call at the time were not responding appropriately. I was a little bit distraught, so I decided I was going to be a physician and try to do a better job than what they did at the time. Also, during the Civil War, I was I provided care to wounded soldiers as an aid to the nurses. I didn't have any formal training, but during the crash course and so I acquired a few skills that helped me to care for wounded soldiers.
Okay. So now after, well, you went to Nebraska then for the medical school.
Yes.
And then after that, what followed?
Then I did a residency in internal medicine in the same institution for 3 years, and subsequently did another 3 years in cardiology fellowship, and finished completion in 1996.
Okay.
That's when I started practice in Omaha, Nebraska, and Iowa. 2 years after in private practice, I had a more lucrative offer in Rapid City, South Dakota. Then I relocated to South Dakota. And then a year there, it was too cold. And I felt since now I have acquired some skills and had some learning that I could live anywhere I wanted in the United States. I decided to travel around and do locum tenens.
Which means what?
It's usually where several offices, cardiologists, they go on vacation and they seek for interim cardiologists to come and fill their positions and cover their patients while they are gone. And then that sometimes takes 3-4 months and as short as a week at a time. So I went to New York, went to Louisiana, I did a week here in South Carolina.
Now, you in your medical education, at some point you decided that you were going to specialize in cardiology. Why was that?
Shortly after graduation, I had a scholarship to go to Kenya, medical scholarship to go to Kenya and provide care in the indigents there. While in Kenya, I was exposed to all kinds of diseases. One night I was on call. I was called to take care of a young lady who had arrested while having an operation. And with my knowledge, doing rotation as a cardiology intern, I was able to save that life. And the feeling was so exhilarating that I decided this would be my calling. If thinking fast on my feet and doing the right thing could certainly turn a hopeless situation around. And so I felt a lot of joy doing that.
Yeah, we noticed that you're perhaps the only black doctor, definitely a cardiologist, that is working with the hospital as well as with the group.
That's correct.
What impact has your race and the fact that you're from Nigeria, what impact or what effect has it had on your relationship with your colleagues on the one hand and your relationship with your patients on another hand?
With my colleagues, it's actually been quite a very positive impact because there's some history that dates back to the Tuskegee study that makes black folks to be a little bit distrusting of the white physician. And so when I came, it was almost reassuring to them that their own kind is here to listen to them. Culturally, there's always some sort of a disconnect between the white establishment and the black folks. So when they see their own black person talking to them about the diseases that can kill them, they seem to take it a little bit more seriously and much more easily able to be reached in terms of getting them to do certain things that could impact their life in the long run. So the community has been very, very happy and they feel quite obliged. I have a lot of black patient population and most of them do seek health care now much more readily than what it used to be in the past. For the most part, they used to just sit at home and didn't think that they would get any help if they sought medical attention. But since my arrival, it's been a very positive impact for my colleagues, for the hospital, and for the community in general.
When Dr. Eaton first came to Georgetown Memorial Hospital, he came as a locum doctor. He was covering for another doctor who was away. And immediately, I said, we cannot let this man get away. So his partner, Dr. Diaz, at the time, was instrumental in getting him to stay. And when he agreed to stay in Georgetown, I wanted to welcome him because the black community didn't have anybody of his nature here before, especially a specialist. He told me he was a pharmacist and a cardiologist. Once we had an internist medicine doctor, Dr. Beck. He died. He was 82, 83 years old when he died. There was no one else to replace him. When Dr. Eaton came, we really needed him, because this community was begging for someone of their own kind. So,
and by that you mean the black doctor?
The black doctor, the black community.
Right.
So I got together with a couple of my friends, and we hosted a reception. I invited all the people that I knew was important to introduce this man and say, whatever it takes, let's keep him here. And that meant the political leaders, the educators, and the administrative leaders in Georgetown, along with the church leaders. Even though he's not a preacher, they invited him to speak in their pulpit. One of the biggest church in Georgetown, which is an African Methodist Episcopal Church, Bethel AME Church. On many occasions, he has spoken in the pulpit on Sunday to replace the ministers who may have been gone. You know, but since his inception into Georgetown, people don't feel that they have to go away, meaning to Charleston or Myrtle Beach, to receive the care and the understanding from someone of his nature.
Right.
And for the older community to see somebody like him, vibrant, you know, enthusiastic about his work, he was just what Georgetown needed. And so we're so happy to have Dr. John Igemi.
John's been a very hard-working addition to our group. He's quickly established himself very well in the community around Georgetown. He's a very hard-working person. He's very committed to his patients, and he his patients look up to him a lot, and he has provided a significant amount of coverage to the people with heart disease here in Georgetown County. Especially with the African American population, they really bonded with him. He's the first African American cardiologist in the area, and there's been a special bond there.
And so what would you say his greatest contribution since he joined your group has been?
Well, several things. Number one, again, like I said, he's very committed to his work, and he's somebody you can count on to at all times to do what needs to be done in order to provide the services that we do. Secondly, he was the first one of us implanting pacemakers, so that added an extra service that we weren't providing as part of the group, that we were sending out referring out to other people. So now he's been doing a lot of pacemaker implantation, which we weren't doing before.
John's work ethic is amazing. You know, the man will outwork just about anybody in the practice given the chance. I have no problems referring patients back and forth between him and myself. You know, we cross-cover our patients all the time, constantly bouncing ideas off of one another.
Tall Drums is presented by Sungai Corporation, publishers and consultants.
Now, in the book Tall Drums that you were featured, in which you were featured, you said something about wanting to bring a little bit of America back to Nigeria as part of your current aspiration now. In what way have you done that, or in what ways do you plan to do that in the future?
Since I was able to, following graduation from medical school and completion of my residency and fellowship, I have always visited Nigeria on a yearly basis, on some cases biannually. I have sent home several textbooks, medical equipment, drugs, to the local physicians in Nigeria. Currently, since the creation of Ebonyi State, I was very, very helpful in terms of supplying books to the medical school so that they could gain accreditation, which they have now. Also, I have helped in terms of supplying teaching consultations to the physicians in Ebonyi State. Currently, I am a visiting faculty for cardiology at the Federal Medical Center in Abakaliki. There at the institution, I happen to be related to the managing director, Dr. Ekomo Ojuzo. Through him, I have been able to make some contributions towards providing equipment such as a Holter monitor, which I believe is the second in the whole nation, where you could monitor people's heart rhythm over 24 hours and be able to make a diagnosis as to reasons why they may be having lightheadedness, dizzy. The other thing I have sent home or brought home is equipment called a defibrillator. This is what you can use to resuscitate somebody who has the point of death due to ventricular arrhythmia.
Okay.
Drugs have been supplied as well for blood pressure, antibiotics, and of course vitamins. There's always been a notice that they do make when I come to Nigeria, that the drugs I break for some reason seem to work a whole lot better than the ones they buy locally. Why that is, I really don't know.
Could it have anything to do with the issue of fake drugs?
It's quite possible. I was reading in some magazines where some Indian companies or even Chinese groups tends to adulterate certain drugs that were imported to Nigeria. But currently, I do believe that the NAFDAC is cracking down on that and making quite an inroad for it.
Any future plans about returning to Nigeria, perhaps permanently, or returning to establish something, either professional or personal?
Yes, I have recently gotten together with a group of 5 cardiologists, myself, Dr. Godfrey Achilihu, Dr. Obin Emerole, Dr. Uzoma Evoka, and Dr. Leo, who lives in Wisconsin. We have put together a business plan to try to establish a cardiac center, either in Abuja or any other, or in the East for that matter, to try to bring home some of this expertise that we provide here to Nigeria. And Nigeria is a country of 128 million folks, or more. And with that population and with the affluence, the longevity, 30% of that population certainly is at risk for developing one or multiple kinds of coronary or cardiac diseases. And only about 5% is aware of it. There are certain cases of sudden death that people really have no idea as to what killed their loved one, or what may have killed their father, mother, or father. There's a rampant case of diabetes mellitus, which is essentially a coronary disease equivalent as it's ranked today. And that predisposes a lot of the population to having coronary artery disease. If we are able to establish the Coronary Heart Institute as we intend to, we certainly would bring the services closer to home and at a much cheaper cost. And our 50 years combined experience certainly will be something to reckon with. As we do these things here in the United States, we certainly can do the same at home. That would certainly eliminate unnecessary overseas trips that most people who are privileged do make for medical checkups. All those things can be taken care of right there at home.
Okay. Now let's talk a little bit about your family. Will you tell us about your family, the name of your wife and your children?
My wife's name is Victoria Igemi. I have 3 children. My oldest daughter is 19 years old. She's currently attending Washington University in St. Louis, Missouri. And my son is 15 years old, going on 16 currently. He's attending Creighton Prep High School in Omaha, Nebraska. And my youngest is John Igemi Jr., who is 3 years old. He will be starting K3, Kindergarten 3, come next week at the Low Country Daycare Center.
All right. And the first 2, their names were?
Bromley, Whitney Gladys Igemi is her name, and then Bromley John Igemi. is his name, my second son.
Okay. Well, Dr. Igemi, it's been a pleasure to have you on Tall Drums, and thank you for allowing us to shoot some scenes of you doing some cardiac procedures in the hospital.
It's quite a pleasure, Dr. Gorgie. Thank you.
Thank you. The last word for this episode has to do with Nigerian leaders and the state of the nation's healthcare system. It is common these days to hear that one governor or another has gone overseas for a medical checkup, or that one minister or local government chairman has been flown overseas for one medical procedure or another. Yet, Nigeria is a nation that has the resources to build and manage some of the most sophisticated hospitals and specialized clinics in the world, if the nation saw it as a need for its people, and if the nation sees it as a source of national honor and prestige. Further, even overseas, Nigerian physicians in various fields are teaching their white, black, and brown colleagues the intricacies of sophisticated medical practice. Our guest on this program, Dr. John Igemi, is only one of such Nigerians. In the next episode, we will take advantage of Dr. Igemi's expertise one more time and bring you a blow-by-blow coverage of coronary and pacemaker implantation surgical operations conducted by Dr. Igemi at Georgetown Memorial Hospital in South Carolina. That's our program for this week. Until next week, I'm Ugoji. I wish you peace, justice, and liberty. May you become all that you're destined to be.